Dentistry is doing the most harm out of any medical profession. It's like, here you go, opioids.
What is biologic dentistry? Because it absolutely blew my mind.
Each tooth is alive. It's a living organ. Any disease in the mouth can correlate to the rest of the body. You're taking a look at the whole body, not just the oral cavity. We can help people live a lot longer. How quickly can we help a patient heal? We're getting them off of meds. That's a passion of mine. If you're having symptoms, question it.
Hey guys, welcome back to the Ultimate Human Podcast. I'm your host, human biologist Gary Brecka. I'm here today in Long Island, New York with Dr. Jigar Gandhi, a very close friend of mine and an amazing biologic dentist out of the Stony Brook Dental School of Medicine. I came all the way up here to Long Island today with my wife, Sage, because the topic we're going to discuss today, I don't want to sound dramatic, but may very well change your life, and it could, in fact, save your life. There are so many people right now that are unaware of the link between periodontal disease, inflammation, gum disease, bacteria in the gum, parasites in the gum, dental work, and all kinds of ailments like cardiovascular disease and neurodegenerative disorders and all kinds of symptomology that you may be suffering from that you're chalking up to a consequence of aging. That is not a consequence of aging at all. It's a consequence of pathologies that may be going on inside your mouth. And I'm not just talking about oral hygiene, brushing, flushing, tongue scraping, those sorts of things. I am actually talking about old root canals and dental work that you've had done that may actually be contributing to disease, to pathology, to cardiovascular conditions, to neurodegenerative disorders, to all kinds of things going on in your life or the life of a loved one. So you're going to want to tune in today because we're going to take a deep dive into everything that is linked between your oral hygiene and your oral health and the health and longevity of the biome. So I want to welcome Dr. Jigar Gandhi to the podcast today, a close friend of mine. He's actually done some dental work on me. And I'm really, really excited to be here today and take a deep dive into biologic dentistry.
Thank you, man. Pleasure to be here.
Yeah. So tell me, Dr. Gandhi, everybody knows what a dentist is.
Correct.
But give me a little background on, what is biologic dentistry and what is the difference between that and standard, dental practice, and how did you get started down the road of being a biologic dentist?
So when you practice biological dentistry, you're taking a whole systemic approach. You're taking a look at the whole body, not just the oral cavity. We're trained to look at the oral cavity day in, day out. That's our training. But when patients are coming with diseases, we need to work hand in hand with a medical doctor, physician, whoever it is, to figure out what actually is going on, right? And there's a lot of linkage, and it's all in the literature now, that any disease in the mouth can correlate to the rest of the body.
Well, I was actually just reading a study the other day that they're finding the exact same bacteria in gums and the jawbone and in poorly executed dental work that they find in cardiovascular disease. The same bacteria is actually found in the heart that's in the mouth.
Oh, 100%. Yeah. So you hit it right on the money there, where it's one blood supply, right? The blood supply that's in your bone, in your jawbone, each tooth is alive. It's a living organ. Nerve, artery, and a vein, and lymphatic system, right? So when you have 32 of them, and if something's going bad, that blood is going to transfer to the rest of your body, all 60,000 miles of blood supply.
Right.
So it's going around.
I always kind of found it fascinating that dental medicine, and dental physicians are the only area of medicine that I'm aware of, the only practice of medicine that thinks that it's okay to leave dead tissue in the body.
Correct. And that's a big problem, right? So when you leave something dead, like anywhere, if your toe had gangrene on it, right? So when you're leaving something dead, it turns gangrene, right?
Right.
So if it was your toe, what are they going to do? Chop it off.
Right.
Your finger, chop it off. Elbow, chop it off.
Appendicitis.
Chop it off. Take it out, right? Remove it. All right. Or liver, part of the liver, they cut it out, right? But yet we're leaving all this stuff in the jawbone. So is it, we have to differentiate between pain and pathogens.
Right.
Yes, we get rid of the pain, the acute symptoms, but what happens in a chronic state now? We just got a pool of bacteria, pathogen, viruses, fungus, parasites that are pooling in the jawbone now.
Right. And, I've been on this journey with you.
Correct.
And I would consider myself fairly woke to wellness.
Yes, you are.
I'm very in tune with my body. I try to watch what I eat, try to watch what I drink. I do all kinds of biohacking tricks. I use red light therapy, PEMF, sun exposure, breath work, cold plunging.
Which I appreciate you doing that, because that's actually got me on one of my journeys too.
Did it? All right,
yeah.
great.
So we met in 2018, and that's what got me on my journey. I
Oh,
started using everything that you're doing,
right.
and then wanted to seek out something else and more and more.
But what
Right.
was fascinating to me was my lack of correlation between symptoms I was having and what was going on in my oral cavity. And to be very specific, I remember calling you and telling you that I had a cracked tooth.
Yeah.
And then I just been putting it off and putting it off and putting it off, because I mean, for those of you guys that are listening that do not like to have dental work, nobody dislikes dental work more than I do. I think I have a childhood fear of it. I don't have any fear of surgeries or of IVs or giving myself injections or anything like that, but I have an absolute phobia of the dentist. And I had this crack, and I just let it go and let it go. And I actually started to notice that the tooth was beginning to change color. So I called Dr. Gandhi, and I was like, listen, man, I've got this cracked tooth. I don't want to get it removed. I really want you to tell me that it's fine. But, it's starting to change color. And he's like, you got to get up to see me, and you got to take it out. And he said, what tooth was it? And I explained where the location of this tooth in my mouth. And I'll never forget, you sent me this chart.
Yes.
And it was a Meridian chart. And I'm going to put this up on the podcast, or put a link to it on the podcast, because I think it's really important for those of you that have had dental work done that you look at this chart, because it absolutely blew my mind, because I looked at the tooth that in my case was infected, and it was tooth number 19.
Correct.
And as soon as I told you the location of the tooth, you asked me 3 questions.
Yes.
And I stopped dead in my tracks when you said this to me, because I had this eureka moment, like a Perry Mason movie, like ta-da,
Yes.
And you said, do you ever get, left shoulder pain? And I was like, well, you know what? As a matter of fact, I do. I get my left shoulder aches when I'm working out, but I always just thought that it was just a little bit of overuse. And then you said, do you ever get left lower lobe pain in your lung? And I started thinking about it. I said, as a matter of fact, when I actually do my sprints on the treadmill, I do that hypermax sprint on the treadmill, I get this catch in the lower side of my diaphragm. And I thought it was just a runner's cramp. And then you asked me if my toe ever itched or went numb. And I was like, that is the craziest question
a dentist can ask you.
Yeah, the dentist can ask me. But I was like, as a matter of fact, I have this weird thing where my left toe will sometimes go numb, and I would tap my foot on the ground. Once in a while, I would actually take my shoe off, and I would itch my toe.
It was the weirdest thing.
You had no idea
so
what was going
weird.
on at the
No,
time.
not any idea.
And I would literally take my shoe off, and I would itch the bottom of my big toe, and I'd put my shoe back on. And so I had all 3 of these things, and then you sent me the chart, and I looked at molar number 19, and it went boom, left shoulder pain, left lower lobe pain, left toe pain. And I'm not saying that the people listening are experiencing that, but if you're having any kind of this strange symptomology and you look at the meridian for the tooth that correlates to it, very often it explains it.
Correct. So when you sent me the photo, because I asked you to send me a photo, right? And you sent me a photo, you had no swelling inside your mouth that you can visibly see.
Or pain.
No ear pain, because usually lower left molar is going to give you ear pain, because that's where the nerve, the inferior alveolar nerve, radiates behind, innervates, goes right behind your ear. So you would have felt it there, and you would have felt when you lay down, you get back up, the hydraulic pressure. You would have said, this is aching. Then you would have been like, okay, let me do something. But you were in a chronic state. And even though you're super healthy, super fit and everything, but this was throwing you off. It was putting you into too much of a sympathetic overdrive.
Right. And
how long did you notice that for?
I dealt with it for months. I don't remember the exact onset of it, because it was just nagging. It wasn't enough for me to say, I've got to go get this checked out.
Correct.
Right. And that's what happens to most people. We just deal with it.
Mm-hmm.
And again, as woke as I am to wellness and in tune with my body and, trying to take the best care of myself, I never correlated those things ever to something going on in my
So
jaw.
why don't more dentists correlate things? Like I'd never heard of, well, I guess I'd heard of Meridians, but that blew us both
But the tooth
away.
Meridians.
Yeah,
Yeah,
the
tooth
tooth
Meridian.
piece just blew me away.
Education, right? It's you graduate dental school, I graduated in 2009, did an intense residency for 2 years. It was just hardcore training, day after day, right? But then you're tired, right? You go to some CE credits just on subjects. Are you really going to study? Or you have some dentists who are curious, want to know why there's disease. Like why is people's health getting worse? Like I've done tens of thousands of surgeries and seeing patients like, why are the patients sick? You
Right.
start questioning it. And then you start questioning what you actually did on patients. You're like, wait, what was I doing? And then you seek out the world's best doctors and knowledgeable in this. And it's stuff that's been, it's out there. The literature's out there. The science is out there. But it's, do you believe in it? Do you want to take that step and actually go that road? And it's very hard to talk to other dentists and other colleagues like, hey, there's something else out there. You know, we can actually be causing harm. It's like do no harm is our first, the Hippocratic oath, right?
Right.
It's do no harm. But it's actually, when you look at it, we're actually doing, dentistry is doing the most harm out of any medical profession out
Leaving
there.
dead tissue in the body.
Yeah.
I mean, you just got to wrap your arms around that there's actually dead tissue in the body and it doesn't have a blood supply. And what do bacteria like? They like dark, moist, oxygen-deprived places
Anaerobic bacteria.
that
That's
the
it.
immune system can't get to. And I want to talk specifically about a study that was just published in July of 2023. So this is only about 3 months old. It was published in the Journal of Microorganisms. But it was a longitudinal study that investigated the association between periodontal disease and neuroinflammatory disorders. And neuroinflammatory disorders are Parkinson's, Alzheimer's, dementia, all kinds of conditions in the body that are related to inflammation that eventually begins to affect nerves.
Yes.
And we don't correlate dental hygiene or, dental pathologies to Parkinson's, to early onset Alzheimer's or dementia. And even before these conditions exist, memory and cognitive decline, exhaustion, fatigue, weight gain, water retention. And what I found really fascinating was that out of the 24 studies they examined, 20 of them showed a positive correlation between periodontal disease and neurodegenerative disorders, with the studies focusing on cognitive function demonstrating the most robust effect.
Yes.
So these are all the things that are robbing people of their short-term recall, their cognitive function, their waking energy, that they may be chalking up to a consequence of aging, that may actually be a consequence of something going on in their jaw from dental work that they've had done that they've left unaddressed.
Correct. And one of those bacteria there, the Treponema denticoli, is proven.
Yes, the Treponema denticoli.
Yeah,
Yeah.
that's new for me.
Sorry,
Yeah, that's
sorry,
No,
That's a big
sorry.
one for me.
It's one of the 5 bacteria. Let's just keep it simple. Yeah, one of the
No,
5
don't keep
bacteria.
it simple.
That's known
go
for
deep.
beta amyloid, producing beta amyloid, which we know is for Alzheimer's.
Right.
Right. So when it all starts here, if we can actually control it, and it sometimes goes more in depth than doing a regular cleaning. Sometimes we have to use lasers. Sometimes we use ozone gas. Sometimes we'll put some medication in the pockets, what we call the periodontal pockets.
Right.
But if we can cure that, doesn't mean like every tooth needs to come out, right? But if we can hold on to the teeth, and we have ways much better than ever before, much better than when I graduated dental
Well, you
school.
say to keep your
Keep
teeth.
the teeth. Yeah, I graduated in 2009. Stuff then was archaic. But the thing is,
You just pulled everything out.
You pulled everything out, or you did these extensive surgeries, but you weren't annihilating that bacteria. Now we have lasers that go into the socket and it's minimally invasive, pain-free. Patients can go back to work the same day or the next day. And technology has progressed so much. And that's a big thing. If we keep on with this technology, we can help people live a lot longer.
Yeah.
If someone already has Alzheimer's or dementia,
Yeah.
do you think that could be something that could start to reverse
I would
it if
100% get a 3D cone beam scan, 3D dental scan, or a scan, or we call it a CBCT scan, and to see what dental work they had done.
Gotcha.
Right.
Yeah, absolutely, 100%.
Because as that dental work ages, this doesn't spontaneously go away.
Correct.
And this is one of the things that, I'll put some of the images up for this podcast for those of you that are actually not just listening, but you're on one of the platforms like Spotify where you can actually see some images. It's pretty gnarly, but it's such an important topic to me because I had such a life-changing experience with it. My 48 hours after you got that tooth out and you cleaned it, and I want to talk about the procedure that we had done, because you didn't just pull the tooth. You actually put red light laser down into the socket. You put ozone gas into the socket. You cleaned out the bone, and then you drew my own blood, spun it down,
Correct.
and created something called platelet-rich fibrin.
Yes.
And you actually packed my jaw, that socket, that hole that you made, with my own platelets.
Yes.
Which a lot of people that are listening to this have heard of platelet-rich plasma or PRP injections. They use them in repetitive use injuries, knees, hips, shoulders, rotator cuff. They actually use it in cosmetic procedures to enhance the vitality of the skin, taking your own blood, spinning it down, isolating the platelets, putting it back in your face. But I'd never actually heard of it being used and turned into platelet-rich fibrin for
Correct.
for dental work.
Yeah.
And so what I did was I documented the entire thing. I'm going to show the entire surgical procedure. Today he's going to be putting a post in my jaw.
A ceramic post.
A ceramic post, not a metal post.
Yeah.
I actually had all the metal fillings taken out years ago. But and I think a lot of people have caught on to that trend of getting the metal out of your mouth.
Yep.
But
Is anyone still putting metal in?
There are some. The European Union actually banned it, right?
Did
the
they really?
US, yeah, the US
They're
is
so
still a
much
little
better
bit
over there in
behind.
Europe.
Yeah, the US is still a little bit behind, but I think
We're always behind.
hopefully we progress to that.
Yeah. Like
stage.
GMO
Because there's
foods.
so many studies that show how horrible it is, and that's why everybody's getting them out right
Correct. There's study after study showing it.
now. So
you
why
know.
would someone still?
You know what the other part is? Taking them out is also toxic, right?
Oh, geez.
So you have to make sure you're following the right protocols to take them out. You can't, because the little particles that are going to go up, if you
And you're
use too much
vaporizing
water,
them, right?
Vaporize. You want the patient breathing some oxygen while you're doing it. You want to isolate the tooth. You need extra suctions in there. It's a whole different protocol when we're cleaning
I've
them out.
seen the setup that you do to take old fillings out. I mean, and it's pretty wild. I mean, you
Correct.
have an entire plastic apparatus in there.
Yes.
Or latex apparatus.
Yeah, latex free,
keep-
but it is. Yeah, you're 100% right. It's a whole apparatus we're using.
Yeah, to keep them from inhalating,
Yes.
any of that gas or swallowing any of it.
And it's for patient safety, staff safety, my safety too.
Right.
It's because we're doing it constantly. I want to protect myself from those fumes because at the end of the day, it is metal toxicity.
Right.
Whether you want to say it's whatever mercury or not, or whatever nickel, palladium, whatever metals are in there. At the end of the day, it's metal toxicity. That's
Right.
going to happen.
Hey guys, I think the most important website you may ever go to is theultimatehuman.com. That's theultimatehuman.com because on this website, we can directly interact with one another. You can give me suggestions for podcast guests and topics that you'd like to see me cover. You can ask me any question that you'd like. More importantly, you can sign up for my entirely free newsletter. It comes out every single week. I write this so I can get the information to the masses on how to live a healthier, happier, longer, chemical-free life. You can also sign up for a pre-order of my book, and if you'd like to take the genetic test that I talk about all the time, it's available there too. And lastly, you can even see all of the products that I use in my daily life for a chemical-free, healthy living style. A lot of people ask me, what do you use in your daily life, Gary? What do you brush your teeth with and clean your countertops with? Well, it's all there if you'd like to see it, and you can, again, ask me any question that you'd like and get my free newsletter. theultimatehuman.com. I promise you that information will help change the trajectory of your life. And now back to the Ultimate Human podcast.
So being a biologic dentist, you have more of a passion and your practice is more centered around restoring what was naturally there.
Back to homeostasis.
Okay, back to
Wellness.
homeostasis.
Yeah.
And I will say I've had a lot of dental work done, and I hate having dental work done. Did I emphasize that enough yet? Okay,
I think I have a picture of you being nervous.
yeah.
No, I'm kidding. I didn't take a photo.
But this was
Was he a big baby?
He was nervous, but he
No,
was
I
fine.
was nervous.
After I got started, he was fine.
Oh, that-
Yeah.
It was
Well,
just-
because
it
the
was
whole
initial.
time I was actually
did-
watching the surgery.
He was watching
on
the
this.
surgery.
Well, and
Yeah.
as you explain things to him, he probably understood
Yes.
it better and,
Yeah.
and got excited about it because then he nerds out on it.
Yes.
'Cause he
100%.
came
Oh, I've
back
been way
from-
down the road now.
Yeah.
He came back like a little kid going, oh
Yeah.
my God, all these, he was so excited about all the things
Oh,
you taught him.
100%. I mean, if we elaborate on the whole procedure on that process, I remember spending 45 minutes. The tooth was out in less than 30 seconds. Like your
Right.
tooth was out, but I spent over 45 minutes cleaning the socket
Mhm.
because there's so much scar tissue inside.
Yeah.
There's a ligament that we need to clean out. We need to help to re-energize the area. That's where we were using the laser at a
Yeah.
specific wavelength. We use a laser.
So that's a red light laser, right?
We use a green light laser there.
Okay.
Yeah, it's a erbium laser at that
Okay.
time. The red light laser was at the end to help you heal.
I remember
So
that
what does
one.
the green do? The green light?
The green, it helps energize the area.
Oh.
So we use what we call a piezo machine first. That helps clean the bone. And the thing is, whenever there's a tooth that's going bad inside, it's just not you just take it out. It's not like taking a flagpole out of the ground. The problem is the bone has pores in it. It's infiltrated inside those pores. So we need to get every single little piece out. And bacteria is microscopic, so
Right.
you don't see it. Even though we use loupes that are high magnification, you're not going to see the bacteria there. But we're cleaning everything out as much as possible.
So
and
use
then,
the green laser first.
we use the piezo first.
Piezo
first
Okay.
to clean out the walls. Then we used the laser to re-energize the area. Then I went to the ozone to basically oxygenate the area, kill anything that's shouldn't be there.
And that was wild because I was watching on the screen. So you took the tooth out and ironically it didn't bleed. And I thought, well, that's a good sign. And you said, no, that's a terrible sign that there's no blood flow to that area.
Just sorry to cut you off there. And I use plain anesthetic. There was no epinephrine in the anesthetic.
Okay.
So because in dentistry, we use 1 in 100,000 or 1 in 200,000 epinephrine. That helps constrict the vessels because the vessels in the mouth are very tiny. They're like the capillaries in your fingers. They're very tiny. But if I use something with epinephrine, it would have not bled at all. So I made sure I use plain anesthetic when I do a procedure like this for you.
Because you wanted to bleed.
I wanted to bleed. Yeah.
So you explained that to me. So you said, I really want to see that bright red blood kind of flowing out of that area. I actually want to restore the blood flow to that area because if you don't get blood flow to that area, the immune system can't get there and kill pathogens. You can't get inflammation out. You can't get any inflammatories in.
Is that part of what led to the shoulder issue?
Correct.
And the toe?
Yes.
Gotcha.
I mean, I've been way down the nerve pathways and everything. I mean, some of the images of the amount of neuronal innovation from the brain to the jaw is just mind-numbing.
You were actually able to even talk with my sister who had a go-kart accident when we were kids.
Yes.
Because she was 9 years old and didn't know how to drive a go-kart, so she crashed it right
straight into a
I did
mailbox.
ask her what happened.
Right
I was like,
mailbox.
it'll bring you back childhood memories.
I don't know. I drove that thing for years and I was fine. Never crashed it once. But my sister got in there and just smashed it to smithereens. But the fiberglass hit her jaw and she just smashed her jaw. All these teeth came out. And she's had issues with her mouth for years.
Correct.
And we knew that part of it, but the part that she didn't recognize is that then later in life, she started to have major kidney issues.
Yes.
And we don't have kidney problems in my family. So it was always like this mystery why she was having such bad kidney problems in college, especially. And it was literally the first thing that you brought up to her. She started crying about it.
She didn't tell me that portion. Yeah. Oops.
You blew her mind.
Yeah,
I think because now she has hope that there is a solution here.
Correct. And that's the thing, like you brought up genetics, right? Not everything's genetic. It's our environment. The oral cavity, each tooth is its own individual environment, and the whole mouth is an environment, right? So that was the biggest thing. It's like, you definitely have issues there. Yeah. And like, we got it. And she sent the x-rays. The x-rays look great. Like, it's like, okay, you can do conventional dentistry there. But is that going to solve everything else for her? No, then she'll, 10, 15 years later, she'll probably need dialysis, and you go down that path. It's like, how long can we keep the human body without artificial joints or medicine, right?
Right.
That's the whole purpose.
What was amazing was that he brought it up to her.
Yeah, exactly.
Right? I mean,
she did not,
she didn't tell me anything of that.
Any of that.
Right. You don't, and we don't correlate a lot of these things going on in the mouth. That's why I think it's so important. I can't wait to release this podcast, and I can't wait to release the full documentary on the surgery, because I just think it's so important for people to understand that these issues that they or loved ones are facing in their life may actually have a fix, a cure, a cause that can be remediated.
Correct. But let's go back to your symptoms, those 3 symptoms.
Yeah.
When I was working on you, and we recorded that too, you felt a jolt of energy.
I did.
Yes, you felt a jolt.
I really did. It was wild. And I also remember very specifically when you had the ozone in that socket, it went from, pink gums and the exposed bone that wasn't
dark red
bleeding to just all this blood flow started to flood the area.
Red. Yeah.
And you were like, that's exactly what we were after. And I have to say, I mean, it was a 2 out of 10 on the pain scale.
Good.
Right. So, if you're thinking about having biologic dentistry done, and I would highly recommend that you do. And if you have any of the symptoms that we talk about on the podcast today, find a biologic dentist in your area. You can probably Google biologic dentist.
Yes, absolutely.
And find a biologic dentist in your area that can do this kind of work, because it very well could reverse or completely alter these symptoms, and literally, might even save your life.
What made you get into this form of dentistry?
It's around when I met you guys too. Carol had,
then we can take full credit for it.
100%.
Yeah,
absolutely.
He's giving us 15% of the credit.
There we go.
Okay. We'll negotiate that
So
after.
Carol did some dental work on her before. She had metal fillings. They turned into root canals. Did those root canals back when in 2014, 2013, 2012, and 2013. Those years, and I never experienced a migraine in my life, so I'm blessed on that portion. But she would experience migraines, and the migraines would be debilitating.
After the dental work.
Yeah, well, I didn't correlate at that time.
Right.
But she would just experience migraines. And we've been together since 2011. And 2012, 2013, 2014, 2015, 2016, 2017, 2018, she had these migraines, insane migraines.
Wow.
And I was like, okay. She's like, there has to be something related. I had buddies check out the dental work I did. They said everything's fine. Because I just questioned myself. I'm like, hey, no, they said the roots are fine, the nerves are fine, everything's good. The 2 teeth you worked on, teeth are dead, everything's okay. I'm like, okay, good.
Teeth are dead. There we go.
Yeah, she said, but she's like, you're taking them out. I'm like, what do you mean? And she's like, no, you take them out. I'm like, they said they're fine. She's like, no. I'm like, I told my buddies, they're like, I was like, you're not married to her? I'm taking them out.
Right.
Took them out, migraines gone completely.
Really?
And the protocols have changed since then. Like, dentistry has gone a long way. Like I use some of the protocols, but now the ones I use on you, like almost 30 steps or 40, like almost close to 30 to 40 steps, literally I use on you. Right. And migraines went away. And then she's like, you're not putting metal in my mouth. I'm like, okay. So then I went down that rabbit hole. Like what else is out there? And that's when I started emailing these guys over the world. I'm like, hey, what are you guys doing that's different? Ceramic, yeah. So the zirconium dioxide that we use. So we use a zirconium implant on you, right? So it's non-metal, it's inert, and it just blends with the gums and the bones so well. And it's mind-boggling. I've done tens of thousands of titanium implants, and now going this road and seeing how the patient changes, how the bone reacts, how the gums react. There's no inflammation.
Right.
And inflammation is every disease. Like, it's like you look at diabetes, it's inflammation.
Yeah.
Right. It's
yeah.
Every disease
Inflammation is the root of all evil.
Yeah. So how can we get rid of inflammation? If we get rid of inflammation and you have a healthy diet, your gut's healthy, the metabolic disorders are gone, there's no reason there should be any illness.
Right.
So why aren't more doctor or dentists doing this?
Education.
Okay. Where did you get most of your education on this?
Switzerland.
Oh, okay.
Yeah.
So you went to Switzerland to get this knowledge.
I went to Switzerland to study. Yeah.
Okay.
So,
there's another interesting study in the American Heart Association published a study on ranties.
Yes.
And I want you to explain what ranties is, but it being associated with morbidity and mortality and metabolic syndrome. And metabolic syndrome is the leading cause of cardiovascular disease, and cardiovascular disease is the leading cause of leading cause of mortality. It's the number one killer in the world. And metabolic syndrome is obesity, diabetes mellitus type 2, and hypertension. And now some doctors will say it's also elevated triglycerides and high levels of insulin. But astoundingly, there is a direct correlation between dental bacteria and dental parasites and the onset of metabolic syndrome. And according to studies, this ranties was associated with morbidity and mortality and metabolic syndrome. So talk to me a little bit about what that is and, how can we fix that?
Sure. So before ranties started, they call it FDOJ or a cavitation or IBD, ischemic bone disease, IBD, right? So FDOJ stands for fatty degenerative osteonecrosis of the jawbone.
Okay.
Or a cavitation, or ischemic bone disease. Now, you could subgroup them all three together, right? But when you look at it, it's basically something that's taken out. Like if we took out your tooth and we didn't clean the bone properly, you'll basically have a pool of bacteria there.
Right.
And it's just not bacteria. It's viruses, it's spirochetes, parasites, virus, anything you want. It's in that bone that's just accumulating.
Right.
And there's still blood that's going all
and
the way around because you're a living being.
Not swelling or pain, because I have no swelling or pain.
And that's the thing about cavitations or FDOJs. There is no issue there. There's no swelling.
Right.
But when you go back in there, it's fatty bone. That's why you call it fatty degenerative osteonecrosis of the jawbone. And you're just scooping it out, and it's fat. So when I was doing surgery,
it's literally soft.
It's literally soft. So it's doing all these implants. It's when I would drill into jawbone. This is before 2018, right? Drill into jawbone. And all of a sudden, you see like oil pop out. And me and my assistant were like, "Oh, look, a person probably just eats an oily diet or whatever, right? You don't know what it is because it's not in the textbooks. Like there are books out there now. And Dr. Lechner from Germany, he's Dr. Rantes. He talks all about this stuff. He devoted his life to this stuff, right? And when you find out like why this is in the jawbone, it's not okay to have. Like it shouldn't be there. Like if that was in your hand, your elbow,
fat
your tibia,
out of
anywhere,
your jawbone.
they would be scraping that out and repairing it, right?
Right.
But why is it allowed in this area?
Mm-hmm.
And then all of a sudden we see disease rise. There has to be something there. Like the
Correlation.
Yeah.
And, another thing that I found really fascinating, and this is super gnarly. And again, I'm going to show the video on my Instagram. I'm going to put this documentary together as revealing as it is for me to do that.
For people.
Yeah, just a little
May
warning
wanna
for
close
you.
your
It's
eyes.
super gnarly, but when Dr. Gandhi had my tooth out, I saw a little pocket on the bottom of the roof.
Yes.
Oh yeah. Oh yeah, that.
Wait, what happened?
There was like a pocket.
There was
like
a sack.
a balloon.
Yeah, at the
on
bottom.
the bottom of the root of my tooth.
I didn't feel it. I'm like, look, feel it.
Yeah, it was like spongy. I go, what is that? I thought it was like a little piece of nerve or something, and it looked like a balloon. And he said, "That's a pocket of bacteria." I said, "No way." And he's like, "No, that's a pocket of bacteria and parasites." So he took it. We put it on a slide. He popped it.
Ew.
We put it on a slide. This is like
the
the
things we
biohack.
find fun, right?
This is the
The
biohacker
dentistry is
in me
easy. The
coming out.
dentistry is easy. This is the fun part.
I mean, I was like super fascinated by it, and then I got a little nauseous because I was like, "Oh, that's my
yours,
tooth."
yeah.
And so he pops it, he puts it on this slide, and he has a dark field microscope in the back of his
Face
office.
contrast. Face contrast.
Face contrast microscope in the back of his office. And we go back, we put it on a slide, and I throw it up on the screen, and I could see the parasites and the bacteria, and I could even see my
Live.
white blood cells.
Yes.
My macrophages going after it like a little Pac-Man,
Whoa.
literally chasing them. It's the wildest thing. So up on the screen, you can see the difference between your red blood cells, and your white blood cells. And then of course there's little spirochetes and bacteria. And the white blood cell the macrophage was literally slowly engulfing it in real time. And I was like, oh my God, that was going on inside my jaw.
Yeah. So I've seen you pick your finger.
Yeah.
And look at your blood
Right.
right before you do the superhuman protocol and
Right.
after you do it, right?
Right.
And you see how your blood cells are moving, how
Yeah.
fresh they are. So now if you did that anywhere, like you just drew some blood, put on a slide and look underneath the microscope and you saw all that stuff, what would you do?
Oh, you'd freak.
You freak out, right?
Yeah,
Right.
like
But-
I did.
But why aren't other people freaking out? Like that's the thing that we're trying to get across to everybody. Like
Right.
this is a problem.
Yeah.
This is connected to your brain, your heart, your lungs, everywhere.
Yeah.
This is very think about tooth number 19 we worked on you, right?
Yeah.
It's
19.
only a few centimeters from your brainstem when you think about it.
Right.
And that bacteria have a major nerve that goes right behind here. And we know nerves travel both ways.
Right.
If that bacteria latches onto that nerve, where's it going?
This is going to be awesome. This is where we're going to actually see the bacteria, parasites, and the things that were actually hiding above my jawline that were actually in my bone right up against my sinus and down in my jaw from that tooth that cracked. And then I had a molar that was cracked too, and I had bacteria up underneath my molar right against my sinus. Wow, this is so cool, guys. You can actually see the bacteria and the parasites that were actually down in my jaw. It's disgusting, but it makes me realize it was a smart idea to do this. I never thought that I would have this kind of bacteria and parasites actually living in beneath my tooth in the socket of my jaw.
So this is the way a red blood cell should look.
Right there.
Yep. And then these are just dying.
Wow. All right, let's.
What we're looking at here is a blood sample from the socket of the tooth that we took out, right? So we put underneath the microscope, it's face contrast microscope, and we're looking at the cellular debris. What we want to see is healthy red blood cells. But we knew the patient was symptomatic, he had problems with his tooth. So all you can see macrophages, you can see a lot of cellular debris that shouldn't be there, right? This is an immune system. He's a very healthy individual, so his immune system's actually fighting everything.
So the immune system showed up and it's starting to attack this stuff.
Yeah. But how long can it keep attacking and attacking, right?
Wow.
And that's the biggest thing. Right. So it's very cool
Man,
to look at it
I'm
underneath.
so glad I got this done.
You should just be healthy, like red blood cells just flowing through. You shouldn't have any of this immune response, especially in your jaw.
This
right?
is all immune
It's
response,
all-
huh?
Yeah, this should not be there at all. Let's say you came in and the tooth had a crown on it and it
Yeah.
didn't look the way it did,
Yeah.
and you saw that on the X-ray. 99% of dentists would say that's normal.
Really?
But how is that normal? Because if that was in your skull, let's say if it was not in your jaw, but if it was up here, your spine, or your hip, or your knee, your foot, what would the doctor say? Cancer. There's
Yeah.
something there. We need to do a biopsy.
Right.
But why don't we do that in the mouth?
Right.
That's the biggest issue. So we knew you were symptomatic, so we knew something had to be done on this tooth.
Right.
But if you were asymptomatic and we saw the black area, That's not normal because every time you're chewing, all this stuff is going into your bloodstream, right? It's just cycling through. So this should not be there at all.
So when you see these darker areas that look like the blood is kind of clumped up, that's because the blood is stacked up, right? Remember when we're acidic, red blood cells have a tendency to stick together and they stack up. So when you look at them through the microscope, they appear darker. When they spread out and they get thinner, that's because they have the same charge. They're not attracting anymore, they're repelling, so it creates a lot more surface area. Generally, the more alkaline we are, the more separated our red blood cells are, so the healthier that system is. So everywhere that they touch, you lose that surface area. So now that cell can't exchange with its outside environment. And sorry, because I have gauze in my mouth and I sound like a chipmunk because half my tongue is numb. But when two cells have opposite charges, they attract. Everywhere that they stick together, you lose that surface area. So now the cell can't exchange with its outside environment. It can't eliminate waste, repair, detoxify, regenerate. So it's really kind of cool to see this because you can see areas where the blood is not stacked up and it's nice and thin and panned out. There's a lot of mobility, and then you see other areas where it's kind of stuck together. So look at the flow of red blood cells here. So this is an active flow of red blood cells. These are the ones that we just pulled out of Madison's jaw from underneath of her infected tooth. White blood cells. You can see red blood cells. It's called macrophages. There's a lot of migration going on right there. So a lot of these are just healthy red blood cells. The big white dots that you see are called macrophages. This is a part of the immune system that goes in and cleans up foreign pathogens.
Okay, so here's another question. Are there any teeth that we should be concerned about that lead to other behaviors of his? It's like, should we be
She wants to pull them all out.
She does need some more
teeth?
dental work today, so you tell me the symptoms, we can figure it out.
Oh, there's a lot of symptoms. Do you have like a couple days?
They might all be coming out.
We call the
Can we just-
anesthesiologist.
Can we
You didn't
just
eat or
start
drink
over?
anything
Yeah.
today.
Yeah.
Yeah. But also the cool part, remember after there was a lot of blood, like the fresh red blood, when I was happy, I told you now it's bleeding.
Right.
now, and you saw it on the screen, we swabbed your blood again.
Yeah.
And we could compare it. And what'd you see on there?
Yeah, that was beautiful. I actually showed the slide afterwards. So I showed the slide with the pocket of bacteria.
Yeah.
And then I also showed the blood sample afterwards. You can just see these beautiful cylindrical red blood cells kind of slithering around, bouncing off of each other. There was lots of mobility in there. There were no parasites. There were no bacteria. There were no white blood cells anywhere on the slide. So you could see that the infection and the parasitic colonies were gone, and even the white blood cells were no longer at that site. And when it's so gnarly to talk about it and to think about it. It's even more gnarly for me to know that it was in my body. But since then, I can tell you, what else was odd was, my nose ran for a few days.
You had another tooth we worked on too.
Yeah.
Yeah.
And afterwards it cleared up and I felt amazing.
Yeah.
I called him for like a week. I was texting him every day. I'm like, dude, I feel amazing. I mean, I kind of always feel amazing.
Sent me
but I
a
felt
thank you
super
message
amazing.
because you kept like going like,
Yeah, I
So-
wasn't doing
there's
that
a lot
anymore.
happening in here.
Yeah.
But that was,
Drove me
and
crazy.
you didn't feel any symptoms on the top right as well.
None.
And I was like, dude, we're taking this tooth out. You're like, why? I'm like, you had a huge infection there.
Yeah.
Wow.
That's why, and it's a contained infection. There's no swelling. There's no pain. There's no inflammation. You're eating food fine. You don't even feel any pressure or dullness or anything. So, people that have had these root canals done could very well have these colonies. And how did they get that checked out? Like what?
A 3D scan.
3D scan.
3D
Okay.
scan. You check the 3D scan. You can look at the different densities. Every scan is different setup, like depends on the manufacturer. But you can see, like, you trace the root, and we did that for every single one of your teeth.
Right.
Trace the root all the way down into the bone and look at all three different directions.
Okay.
You-
He's listening to this and they're like, okay, I'm going to try to find a biologic dentist in my area because I've had root canals done in the past. I have some of the symptoms you guys are talking about, brain fog, weight gain, water retention, memory issues, or even worse, I have a neurodegenerative condition that they don't know the root cause of.
Sure.
they want to, when they contact that dentist, they want to say, do you do 3D scans? Or,
Correct.
Okay.
Yeah.
So they can
Majority of
find these
dentists should be
cavitations.
doing 3D scans now.
Okay.
There's some that don't, but majority do.
Okay.
And if they're asymptomatic, have no illnesses, nothing, then hey, you at least now there's something there, and keep an eye on it, right?
Right.
And that's what we tell patients. Like, you have choices here: do nothing, take it out, retreat it, and your choice is yours. It's your own. It's your body, your
Right.
choice, right?
But if
We're
you're
just here to
having
tell you.
symptoms,
If you're having symptoms, question it, right?
Yeah.
Don't pop a medication. Don't take ibuprofen or painkillers or like rheumatoid arthritis meds when it can be something that's linked,
Right.
Right? Because then you're going down the pill road, your liver and kidneys are going to become shot. And you brought up a good point where your pain, you didn't take any opioids afterwards, any painkillers afterwards.
nope.
And that's the thing. That's the beauty of doing a process like this, because we got your own blood to bleed again, instead of just packing some gauze in there and say, hey, off you go.
Right.
Instead of like,
Oh.
because your tooth was out literally 30 seconds. Could have
Yeah.
just packed some gauze and be like, hey, next patient, right? But here we spent the time making sure everything was really done well. And you felt the energy. So I was like, I know now I got everything.
Yeah, yeah, no, it,
Yeah.
it felt amazing. You did my daughter. You're actually
Yes.
doing both of my daughters and my wife. So everybody's getting this done.
Yeah.
Like everybody in my family.
Yeah.
The other thing that I'm going to post for these guys to look at, I'm going to post a link to this Meridian chart.
Yes.
Um,
What about your tooth right now? Sorry to throw you.
The one I
out there.
cracked?
Yeah, the one you cracked. So
Yeah.
now I'm curious which
Yeah.
tooth that is and what.
So that's tooth number
symptoms-
30. That's the complete, that's the same tooth, the other side.
yeah.
So
Yeah.
that could
Well, I
be
just
the
cracked
right
it, so I don't.
That could be right side.
shoulder.
Yeah.
Okay.
So it
yeah.
just cracked. There is some black area around it, which shouldn't be black. A tooth should not be black. Like,
Right.
all right. So tooth is stronger than bone, 2.5 times stronger than bone,
Mhm.
enamel, right? And then we got the dentin layer underneath, and then you got the cementum, which is the root, right?
Okay.
But a tooth should not be black. If you had a bone that was black, there's a problem.
Right.
So right now, part of your tooth is black. We
Right.
have to see if that's the materials that we use, the bonding agents, if that's decay,
Mhm.
or it's actually leading to something more.
And here's the crazy thing. I actually take really good care of my teeth. I
You do?
floss on a regular basis. I have a tongue scraper. I brush my teeth with non-fluoride toothpaste, which I want to get into fluoride with you in a moment. I take again, this goes beyond dental hygiene,
Mhm.
right? And this goes to these mainly dental procedures that you've had in the past. But I'm definitely going to post this Meridian chart, because this was the thing that really blew my mind. I literally canceled a vacation and came up to
Yes,
see
you
the
were
next
headed to
day.
Cabo.
You remember?
And I'm like, no,
Yeah.
you need to come up here.
And I was like,
Yeah.
remember?
Oh,
I,
yeah, that's
yeah.
right.
I was going to Cabo.
Yeah, you
Yeah.
were in Cabo already,
there.
and you and Madison
She-
flew up. Yeah.
She was like, yeah, you go get your
Yeah, I
tooth
was like,
pulled.
peace
I'm
out,
going
babe.
to Cabo.
yeah.
Going to the beach.
So she still bailed on me. But
Madison was with you. Only one person needs to be.
yeah.
Yeah.
I took my other daughter who had a bunk tooth, and we went to New York and got
Yeah.
her teeth pulled. So, and now today we're back in New York, and 3 of us are getting teeth today. It was so funny. I was
Fix
like,
this red up.
Alina's getting a tooth, Sage is getting a tooth, I'm getting a tooth. Is anybody else? You want a tooth,
Well,
Max?
I
Max,
actually,
yeah.
the one that you're fixing for me is I went in and had a crack, and they did a root canal on
Yeah.
me. And then when I went back in to get the cap on it, I guess they saw like a microscopic section or something. It had cracked, I
Yeah.
guess, and they couldn't cap it. And so they pulled it, and I remember asking him, "Why? I don't think I want a root canal. Just pull it. If we're gonna potentially have to get there anyway, just yank it out." But he
Yeah.
was like, "No, root canal is way better." And he talked me into the root canal.
God.
Part of me is glad that it all just needed to come out anyway, because I could potentially be having issues.
Correct. And that's the thing, is like we give patients the option, right? And they have their choice. Like
Yeah,
I
I got
won't do it.
forced
They can
into it.
someone else can do that if they want to.
Yeah.
But for me, I know what works in my hands and what I see the results of the patients.
I wish I had known
That's
you then.
that's the best way to see, like, this is the patients could come in, they're sick, and all of a sudden they're healing, they're well.
Yeah.
And not curing everything 100%, because if you've been sick for a long period of time, it needs to reverse. It's going to run its course. It's not like an instant fix. Yours was just starting, and it was like,
Yeah.
okay, hey, let's hammer it before
Thank
it
God.
takes longer. Yeah, because
Yeah.
we were talking about it for a while, but I'm like, dude, that's it.
And so, tell me about some of the cases you've seen where these things you've seen other conditions resolve in a patient after having.
Got it. So you can go with breast cancer, right? You got the lower molars and upper premolars are linked to breast cancer,
Okay.
right? And if there's no genetic history at all, and there's no genes at all that lead to breast cancer, but yet those teeth have dental
The
work done on them.
BRCA gene or.
Yeah, and they had dental work done on them, and then they're infected, and then all of a sudden the patient has comes down with cancer.
That happened to a
So
girlfriend of mine. I'm curious.
so if we can work as a team, like oncologists, hey, let's work as a team instead of like, no, let's just do the cancer therapy, but now the patient can't eat. They're miserable. They have infections in their jawbone, right? So the problem is the dentist is the last person to see in this
Right.
whole group. The dentist needs to be at the top of the game here. It's like everyone needs to quarterback this thing,
Right.
right? Okay, well, disease free in the mouth, all the bad stuff is out. Okay, now if you got to get the chemo, you got to do the radiation, go ahead, do it, right? Whatever it is, do. But at least you got the toxins out.
Yeah.
Well, if you leave all these toxins in there, where they're accumulating, and the meridian pathways, this is ancient Chinese medicine, 4,000 or 5,000 years, and
Yeah.
it's proven, right? And all of a sudden, it's like they go, it stops, like
Right.
it's not
Yeah,
progressing.
I don't think
it's
it's any-
insane.
You know,
Right.
it's no accident that the exact same oral bacteria that is found in these cavitations. And by the way, cavitations is an area where, you know, if you've had a root canal and you've got dead tissue, this
Or tooth pull,
cavitation
then it's
or
a dead-
tooth pull,
yeah.
this area where there's dead tissue is an area where all these bacteria and
Correct.
pathogens gather, and we call it a cavitation. But the identical bacteria is found in cardiovascular disease in the heart. And so, and if you look at how the mouth drains, you know, too, I mean, right into, right into the heart. So it's very easy for bacteria to migrate there. And I don't want to fear monger, you know,
No, the
everybody,
root canals work, right? If someone's in acute pain, you got to do it. You got to get the person out of pain.
Yes.
It works, right? The problem is that it starts to break down, right? No matter how good anything is, the human body breaks down. Things are going to break down. And the maintenance, if it's broken down, it's not treated, pathogens are going to seep in. The
Right.
mouth is the dirtiest place in the body.
Right,
It's really
right,
dirty.
yeah.
At the end of the day, there's so
Dirty
much
mouth.
bacteria.
Yeah.
Even though it doesn't matter how much you clean, floss, mouth rinse, whatever it is, right? And we need a watertight seal. And if the
Right.
seal is broken, everything is going, it's, again, each tooth has a nerve, artery, vein, lymphatic system, but it should be closed off one end. Remember, the thing that's sticking up in your mouth is a bone. You don't have a bone anywhere else sticking out. If you did, you'll be in pain, right? If your tibia were sticking out, you'd be like, holy cow, this hurts, right? But you're not with your tooth, right? That's the only place in the body. And now if there's an issue with it, it's going to get into the nerve. And from that, it's going into the bone. Now it's spreading. Right. So we need to catch it before it gets there.
Right. So let's talk about things that we can do to prevent that. And I also want to talk to you about your stance on fluoride. You know, I've done a lot of posts and discussions about, you know, fluoride's been proven to be a neurotoxin. There was a recent study that was published looking at 3,600 municipalities across the country and actually finding an inverse correlation between fluoride and IQ. Meaning the higher the concentration of fluoride in the water, the lower the IQ in those municipal locations. If you want to see that study, I'll put it on the podcast as well. But so I know when I was growing up, you know, they would put that little
Fluoride
fitting in
treatment.
your mouth and you would get a fluoride treatment and it had that awful pungent, great taste.
Then you could pick your flavor. I remember that.
Yes, it's all flavored.
Yeah, but
Correct,
it was like really flavored medicine, like
Yeah, it was terrible.
really shitty, like cough syrup.
Yeah.
But so what's your position on fluoride or using fluoride toothpaste or not using toothpaste doesn't have fluoride in it?
So for me personally, I use fluoride-free toothpaste, fluoride-free mouthwash, right?
Okay, I'm happy to hear that.
Yeah, 100%. So fluoride's an electron stealer, right? So it's stealing from everywhere else it needs. And it's very reactive, right? Because it's in the same periodic column, bromine, right? Or bromide, right? So it's the same area, right? So it's very reactive. The biggest issue that we face as dentists is someone's coming in with a mouthful of cavities. We have nothing else in our arsenal. Like if they're not changing their diet, their lifestyle is not changing.
Right.
Without teeth, your nutrition is garbage, right? You need teeth to chew.
You
You can't masticate, right? Even if you had dentures, you're still not chewing. Like people are like, oh, I chew with my dentures. Like, sure. How much are you really chewing your food? You need nice, sharp teeth to really crush things, break things apart, and really grind and chew. And it's functional, right? Because there's a joint that's holding your teeth, hold up this joint in the muscles. So now back to the fluoride problem is if someone's coming in with a lot of cavities, we have nothing else in our arsenal, right? If they're not doing their home care. If they're going to change their home care, they change their diet, they change their lifestyle, then we don't need to.
Right.
So we got to pick and choose.
Sure.
So yes, does it work for patients who need it? Yes. what I'm seeing now, we probably see we see a lot of patients a month, but maybe one, maybe two patients a month with rampant decay.
Is there
We
a
don't see
reason
that
for
much
that?
decay.
Is it hereditary? Do
Lack
people?
of
I always hear
hygiene.
like soft teeth get more cavities.
If they had soft teeth, the rest of their bones would be soft.
Okay.
Yeah, so, you know, it's
So
something that
that's
you
an
mentioned
excuse.
earlier before we started the podcast. Someone mentioned to you like soft teeth, right? Or you or a family member would have soft teeth. But no, like that was just something a dentist said to somebody. Like if
Yeah.
your teeth were that soft, you would literally have other diseases going on,
Right.
right? Because bone, right?
Yeah.
So you got to break it down. What is a tooth? It's a bone, right?
Right.
It's stronger than bone, right? So,
Well, like, why do some kids get like? I've had one cavity in my entire life.
Sure.
Some kids, although I did get told by a dentist after I had my daughter that I had 10 cavities out of nowhere because he tried to convince me that since I was breastfeeding my daughter, she was sucking all my nutrients out, and he
Oh my
he
God.
almost got me
Jeez,
for 10
yeah.
cavities.
well, I'm glad you didn't go that road. You got a second
Yeah.
opinion.
Oh,
You
yeah.
know, so what I like to do is always take photos. I need the patient on the same page as me. So here are photos of your teeth. Even if some patient like, I don't want to see it. I'm like, here's a photo of your tooth.
Yeah.
This is the plan for this tooth. Each tooth has its own individual plan. So 32 teeth, 32 individual plans.
Yeah.
Right? And this is how we're going to get everything better. Soft teeth, I don't believe in. So there's a genetic condition, very rare. But does it work for some patients? Yeah, because they're not going to change their lifestyle.
Yeah.
You know, again, and I heard you say it easier, like, you know, when you talk about the cold plunge, if there was a pill, people would do it.
Right.
Oh yeah.
Who would
Makes
be
it
willing
easy.
to go through that, right?
Right.
And that's the same exact thing. It's like, here's not a pill, but here's the cream, here's a toothpaste. It's a lot easier than changing the diet and lifestyle.
Gotcha.
Right. Well, I will tell you, my own personal experience was that the procedure was not as nearly as painful as I thought it was going to be. Like I said, I experienced a pain level of 2. The aftermath was extraordinary for both me and my daughter, Madison. I mean, we both experienced the same thing, like more energy, like sinuses didn't feel, you know, congested. The shoulder, the lobe pain and the toe issue, all
your
my
weird
itchy
itchy
toe,
toe.
like all went away. It hasn't come back since. And, you know, the point that I really want to emphasize is that, you know, people can find a biologic dentist in their area and at least go get it checked out if they're having some of these kinds of
Correct.
symptoms. You would recommend that they do that.
Oh, 100%. At least this way you know what's going on, right? So, and then you don't have to proceed right away. You can at least know, like, hey, I have a game plan now.
Right.
So if something happens or something leads this way, you question your physician, or you question your doctors, right? So the biggest thing for me is instead of using Google to figure out your symptoms, go to PubMed.
Right.
Right? Go to PubMed, get the articles, and then take it to your doctors. Hey, it says this online. And when you say online, no, it's actually PubMed articles. What do you
Because they'll
think about it?
respect that over
Or what do you
WebMDing
yeah,
themselves to
yeah,
death.
exactly. WebMD or just Google, or they say, oh, my friend said this,
Yeah.
right?
Oh,
Here's
that
the
must be your
proof.
favorite.
And when
Yeah.
you do that, I think it makes a huge difference. It's because now it's like we're not doing. There's no weird stuff. Science,
Right.
just
It's
science.
science. Hey,
Literally,
That's my term.
Yeah,
It's
I think it might
trademarked.
be trademark.
yeah, sure. Just science is trademark?
Yeah, that's just science.
Oh, that's
I
just
say it
science.
all the
Okay.
time. I end every podcast with that's just science.
Sure.
So what
Stole
other
your
type
pie.
of
Sorry.
what other type of modalities are you using that other practices are not that you think are different and helpful and I don't know, cutting edge, I guess.
That a biologic dentist might use, yeah.
Biologics.
So PRF, right? Using our own blood, we use the concentrate, and then we also make the membranes from there.
The plate-rich
Plate-rich
fiber.
fiber. Yeah, the
Yep.
plate-rich fiber. And then we're using the lasers. There's different lasers. Like I have 6 different lasers in the
wow.
office.
Wow.
We have lasers every room. Like that's the operatory. We use a laser.
Okay.
Right? It's a daily thing we're using our practice because we know it helps. It's killing the bugs, the bad bugs, right?
Right.
And then it's helping
And it's
healthy tissue
painless.
grow. And it's painless. And the recovery helps. That's the thing. It's how quickly can we help a patient heal? We're going
Right.
to create inflammation, but if we take the inflammation and the bad markers out of there,
Right.
now the good markers, the body can heal. So we just offset it quicker, right?
Right.
So the lasers, then we're using a lot of ozone. The ozone, it's an extra oxygen, so it's 3 oxygens, highly reactive. As soon as it finds a bug, it's killing it because
Right.
it's a negative charge.
And then it's only leaving oxygen gas.
That's
what's
it.
left over.
yeah,
Which
and-
goes into the bloodstream.
which you need
and it's fine.
oxygen. That's
Right.
that's life, right?
Yeah.
So
So you think of all this porous bone, and it's like, how do I get down in there and get after all those little bugs? I mean, gas, ozone gas can get down in there, and actually, it's cytotoxic.
Yeah.
And bactericidal, meaning it'll kill the bacteria and,
Correct.
and kill the pathogens.
And just not bacteria, parasites, fungus, viruses. It's drilling a hole in those cell walls because there's no antioxidants there, right?
Right.
So it's gonna kill it, annihilate it.
That's
right?
great.
Yeah.
Hey guys, as you know, I do not push products on my podcast or my social media unless I use them in my everyday life. This is one of those products. Most of us have a very difficult time meeting our protein needs, and certain protein sources like whey protein and others can be as little as 20% absorbable. This is 99% absorbable, and it has all of the essential amino acids that the body needs to build lean muscle, to recover, to improve our exercise performance, and most importantly, to repair after we have intense exercise. So this is called Perfect Amino by Body Health. It's, like I said, 99% absorbable. It only has 2 calories. Eventually, the caloric intake has virtually no caloric intake. It will not break a fast. It tastes amazing. You mix it in water. I take this literally every single morning. If you're working out in a fasted state, you have to take a full spectrum amino acid prior to your workout to preserve your lean muscle and make sure that you're recovering properly. And again, it will not break your fast. So the caloric impact is virtually zero. You get all of the full spectrum amino acids. It tastes wonderful. I use it every single day. You can go to bodyhealth.com/ultimate. That's bodyhealth.com/ultimate and look for the perfect aminos. They actually come in capsules if you're on the go, or it comes in several flavors that they make in a powder, which I love. It's flavored with natural means of flavoring, so there's no artificial sweeteners in here. So this is one of my absolute favorite products. Give it a try. If you're working out at all, you need a full spectrum amino acid. Go to bodyhealth.com/ultimate. That's bodyhealth.com/ultimate. I love their lab tested products. You can actually see the absorption rate for all of their products. They've got great electrolyte protein combinations. My favorite is the perfect aminos. Bodyhealth.com/ultimate. And now back to the Ultimate Human Podcast.
That's great. So, I actually have another study here, and this was specifically on the effect of laser therapy, and this is red light lasers. I'm a huge believer in photobiomodulation, red light therapy, sun exposure, things like that for reducing inflammation and optimal health. But this is about red light lasers and their use in cytokine concentration, so markers of inflammation.
Correct.
Specifically in the jaw. And also that it stimulates angiogenesis and fibroblast proliferation. And angiogenesis is the new blood vessel growth.
Collagen.
Yeah.
There you go.
So after this procedure, you're actually strengthening the bone, strengthening the gums, strengthening the jaw.
Correct.
By restoring all of this blood flow.
Yep. And then I gave you red lights after to go home with. And what did I tell you? Just shine it on that area.
He gave me a red light.
Oh yeah, he came home with all his little boxes of toys. I'm telling you, he was literally like a little kid when he got
but it
to
works.
Cabo.
It totally
heals.
works.
Yeah.
It healed so fast.
Yeah.
It was astounding. And Madison and I, my daughter and I, we call each other every day. And I'm like, "Do you have any pain?" She's like, "No." I go, "I don't have any pain either."
Yeah.
And she's like, "Dad, it's totally healed. I don't feel like I had the procedure done." I'm like, "Me too."
I still told you to take it easy for a week because knowing you.
Yeah.
That doesn't happen.
Yeah. But see, that's the thing. We get patients off of meds, painkillers,
I was gonna say
antibiotics. We're
literally-
getting them off of meds.
Yeah.
And that's a passion of mine. Like, well, people don't need to be on meds. Like
Right.
dentistry, it's like all right, fine, take a Tylenol, but let's get rid of the opioids.
Yeah.
Right.
And if we can do that, and you already had major surgery, right?
Yeah.
And usually it's just like, here you go, opioids. Right.
Yep.
That's
I didn't
to give
have
it to
any
you.
of those.
Yeah, and we're in Cabo where he literally could have gone to a pharmacy. They would have just hand delivered him whatever he needed. But
Yeah, but I remember
he
I was
didn't
down
need
there.
anything.
Yeah. I didn't need anything.
Yeah.
Yeah, it was impressive.
So I really, really appreciate that. Is there anything else that you think these guys need to know that we need to cover before we...
One of my mentors always says, if it's metal or dead, get out of your head. It's true.
Metal or dead, get out of your head.
It's one of those things. If it's causing a blockage or causing inflammation, it's like when you go to the dentist, have them look at the tissue. Right, the tissue gives you everything. Even if you had no X-ray, like if I didn't take any X-ray, I could tell you have inflammation here and you have inflammation here.
Mm-hmm.
Now let's deep dive into why you have inflammation there.
Right.
Let's take the scan. Okay. Oh, it shows. Now we can correlate them. There's no reason why your gum tissue should not be nice and healthy.
Right.
Right. And even if you had dental work and your gums are puffy, question it.
Right.
Don't just say, okay, oh, well, that's normal.
Yeah. And the
shouldn't be
big
normal.
takeaway, you know, the reason why I share my personal story is the big takeaway is that I had no pain, no inflammation, no swelling, no pressure, no symptoms in my jaw at all, other than my tooth was starting to change color, but it was completely painless. And I put it off forever until you sent me that chart and it correlated to all those symptoms. And that's when I canceled my trip to Cabo, went up and had it done. All of those symptoms have gone away. I really would encourage folks that are listening to this podcast, if they have a loved one that's suffering from a neurodegenerative disorder of any kind, or they have brain fog, muscle aches, weight gain, water retention, poor short-term recall, and they've had dental work done recently or in the past, especially a root canal, it's not a big deal to go get it checked out by one of these 3D imaging
Correct.
devices and at least see if you have a cavitation. Now, are these cavitations, these pockets of bacteria and pathogens, are they visible on the kinds of?
You can see
Would a
the
dentist
difference.
know that it's
You
there?
can see the difference in the bone density.
Okay.
Correct.
Okay.
Then you start questioning. You play detective work. You say, okay, when was this tooth taken out? If it wasn't taken out, why is there an issue there? Did you get your sister who had a childhood injury? I saw
Right.
saw it on a 2D image on there, and I questioned it, like
Right.
why she had a mark in her jawbone still.
Oh,
Yeah,
right?
it was very specific too, because when he went through my X-rays and my images, you could see that there was a pocket of some sort
Correct.
there underneath my tooth in
Yep.
the one that was affected, and happened to be the one that was discolored.
Yeah.
So, and if you guys, those of you that really want to see the gnarly video,
yeah.
It'll be on.
I'm gonna post it on my Instagram. The full video. It's all shot in high res. Dr. Gandhi talks us through the whole procedure. So if you want to see what the entire journey was like, you're welcome to look at the journey. The coolest thing is that slide where you actually see my white blood cells going after pathogens and the parasites and the bacteria. And I just could not get over the fact that was sitting in my jaw. And even though I eat clean water, I mean, I drink clean water.
You
I eat
detox
a
your whole
clean
body.
diet.
You detox your
Yeah,
whole body.
He's on it.
Yeah.
I'm pretty
But you
on my
gotta
game.
imagine you had inflammation.
Using red light, I'm
Yeah.
using cold plunging, I exercise, I get enough sleep, and yet this was going on, and so even if you're really practicing good oral hygiene, you may have some.
And that's the other thing, right? So if someone's going through a whole detox and they have inflammation in their mouth, there's no way. The mouth's going to be acidic. There's too many toxins.
Right.
So you're going to relapse. And then you're going to say, well, my sister did a detox or my friend did it. It worked for them. It's not working for me. Now you give up.
Right.
The reason why the detox is not working because there's things going on right here.
Yeah. In
And
the
if
jaw.
that's not handled, then that's the problem.
So interesting.
Well, this has been amazing. I super appreciate your time today.
Appreciate you.
I can't say that I'm excited to get my tooth yanked, but
I'm
I'm
excited to
getting it
get
done.
mine put in.
Yeah.
What are you going to use? What do you use to
We're going to use a ceramic implant there.
ceramic?
For you. Yeah.
Okay, very cool.
Yeah.
So
and then we'll
we
see
will
if we
follow
put
your journey too.
Yeah, if we put a temporary on there or not today, we'll see, just depending on the stability. Because you did have the tooth
Yep.
taken out a while ago, so
Yeah.
I still want to clean out the jawbone. Now, again, I didn't do the surgery for you, taking the tooth out. So I'm still going to use the same protocol as we did for Gary, cleaning out the jawbone, make sure everything's healthy before putting an implant in there.
Okay.
It's not just like a 1, 2, 3 surgery. Even though you have the bone, it's need to see what's still lurking in there.
Right.
So if it's still in there, we're going to clean it out, make it fresh bone, let it bleed, and then go ahead and put the implant in there.
Yeah.
Yeah.
I end every podcast by asking my guests this the same question. There's no right or wrong answer to this, but I ask every guest the same question. What does it mean to you to be an ultimate human?
So it means to wake up every morning wanting to get out of bed, not hitting the snooze button, excelling in life, doing everything you can to the full max. And there's no stoppage, no barriers. There's mental clarity, and there's no aches and pains getting in your way.
Wow.
I like it.
That's a good one.
That is a good one.
I don't think I've ever asked you that question, so maybe we'll do that on a podcast. You might say your husband, but
I do want one of those hoodies, all right?
merch is going to be available online very soon.
Merchant's coming soon.
Yeah.
But guys, if you were inspired by this podcast as I was, and it was a very inspirational journey for me, I'm going to document the entire thing on Instagram, as I said before. If you're not in the Long Island area in New York and can't come see Dr. Gandhi, then search Biologic Dentist in your area, because I really encourage you, if you're having any of those symptoms or a loved one's having those symptoms, to have a biologic dentist check you out. And as always, that's just science.
No weird stuff, just science. There you go.